Hi, everyone. My name is Kim Whitmore. I'm an assistant professor in the College of Nursing at Marquette University and a research consultant with ARCH. And I'm excited to present to you on advancing respite by building bridges among respite researchers. Today, we're going to provide an overview of ARCH's Respite Research Initiative, as well as talk about the Committee for the Advancement of Respite Research, or the CARR. I want to start by sharing a little bit about the ARCH National Respite Network. For those who aren't as familiar, they provide a variety of supports, including a training and technical assistant division, the National Respite Locator Service, support the National Respite Coalition, and through funding from the Administration for Community Living, run the Lifespan Respite Technical Assistance and Resource Center. So I encourage you to check out their website to learn more about all of the great programs that ARCH provides. ARCH is also very interested in advancing respite research, and the following are the current goals for these initiatives. The first is to improve access to and quality of respite services. The second is to identify aspects of respite services and models that make them exemplary. Next, evaluate and replicate promising respite services, how important it is to translate these respite research findings into practice and policy. And I think fundamental to all of this is identifying additional possibilities and funding for research. So why is research important to the future of respite? For so many reasons, as you can see here, but really it allows us to look at model development and continuous quality improvement. It helps us to do efficiency testing and outcome evaluation. It can build that evidence base for the importance and value of respite care. And that's very important for advocacy and funding of continued respite programs across our country. And ultimately, the hope is that through this work, by improving respite services and supports, we are improving lives and well-being as well. So one of the things that ARCH did is they established an expert panel on respite research. This expert panel explored in depth the current status of respite research and proposed strategies to overcome barriers to research. And you can download the report, the research agenda for respite care, from the ARCH website, which is the deliberation and recommendations that outline a plan to encourage rigorous research in key areas that will translate meaningful strategies and approaches to care. The expert work group also developed an inclusive definition of respite, and I have a little caveat here that this is pre-pandemic. We know the pandemic has certainly changed a lot. And what I love about this definition is the second half. I think the first half is how we commonly understand respite as being a break from caregiving. So it's that planned or emergency services that provide a caregiver or of a child or adult with special needs some time away from those caregiving responsibilities. But they add "and," which result in some measurable improvement in the well-being of the caregiver, care recipient, and or family system. So that outcome is so important in their definition of respite. This slide highlights the 6 key areas that were recommended through the expert panel in the research agenda. We have recommendations around improving research methodologies, looking at individual, family, and societal outcomes, doing more research in cost benefit and cost effectiveness, systems change that improve respite access, looking at improved respite provider competence, and finally translating research findings into best practice models. Next, ARCH established the Research Consortium, and this really was to help implement the expert panel's research recommendations. So there were more than 30 foundations and government research programs that were identified that had potential interest in funding respite research. And through the consortium, we tried to continually identify academic scholars and researchers and connect them to these funding opportunities so that we can have more research in this area. So if you're interested in being a part of the research consortium, please reach out to ARCH. ARCH also has an annotated bibliography on the website that you can download. It's now in its 5th edition, and I encourage you to take a look at that important document as well. In 2020, in the heat of the pandemic, we had a Respite Research Summit that became virtual due to the pandemic. And at this summit, we had just incredible conversations and dialogue with researchers and others across the country, and came up with some key research considerations that you can see listed here. You can once again download that entire report from the summit from the ARCH Respite website. And now, currently the work of ARCH is sitting in the Committee for Advancement of Respite Research, or the CARR. So the research-related work is really leading the next phase of ARCH's work in building this evidence base for respite care. And they've considered those findings from the Respite Research Summit and really prioritized some key areas. We've formed work groups around 3 areas: defining and measuring the value of respite in the context of our research, recommending common data elements for respite-related research, and expanding culturally appropriate research with hard-to-reach and serve populations. And cross-cutting through these three work groups is the recognition that all of this sits in the context of COVID, and we can't ignore the impact that COVID has had and will continue to have on respite interventions. So I am at time, and I just want to leave you with reminding you that throughout this work, it's important for us to put on our own masks before assisting others, and encourage you to take that time and self-care for yourself so you can continue to do the great work that you do. This is the contact information. Encourage you to check out Arch's website and reach out to Jill or myself if you have any questions. Thank you